Hello, everyone. My name is Anna. I'm the clinical practice specialist from Sensing Future Technologies. I want to thank you for attending today's webinar. Let's just wait 3 minutes more for more people to join, and then we can start. Okay? See you in 3 minutes. Okay, so I think we can get started now. So for the people that just joined, I'm Anna. I'm the clinical practice specialist from Sensing Future, and thank you for being here. I think we can move on with the presentation. So I want to start by briefly introduce myself. I'm a physiotherapist, but I've been working with Sensing Future. I have a master degree on exercise physiology, and my role here in Sensing Future is to help to develop our devices in accordance to the latest scientific evidence. And of course, with the reality of the clinical practice work, since I have been there, I know the particularities of working on the field. And so I try also to give my input on the development of our devices. And I also try to help our PhysioSensing users to take the most of our devices. And well, I think that sums it up. So I want to thank you for attending today's webinar. It's going to be focused on perturbation-based balance training, but I'm going to go through some other topics, such as balance control system and the main resources that are required for postural orientation and stability. The scientific foundation of perturbation-based balance training. I'm going to go through also motor cognitive training and some of the, again, scientific evidence behind the use of motor cognitive training. And I will show you some functions of our Kine-Sim device that allow us to perform both of these two interventions. Okay, so let's move on. Before we go more into depth on perturbation-based balance training, let's recap a few important aspects related to postural control. So we know that postural control serves two purposes. We have the purpose of postural orientation, so the ability we have to orientate ourselves within our environment, so to create an image, a picture of ourselves in relationship to our surroundings. And so here we are talking about the information that we can collect from the environment to build this image. So we can answer the question of where am I? And then we have the purpose of postural stability. Here is the ability we have to control our center of mass within our base of support, the motor output, the adjustments that we have to do in order to maintain our balance. And so, as every aspect that is related to motor control, postural control also emerges from the interaction of the individual and all of this motor sensory systems part of the individual with the environment and with the task itself. So different environments and different tasks will require different responses of postural control. So there's going to be the need to have flexibility, and those motor sensory systems have to be dynamic. Okay. Okay, let's move on. And so for collecting information from the environment in order to create a picture of ourselves, we collect information through three different channels. I say three different body systems. So we have the somatosensory system, collecting proprioceptive information, joints, muscles, and mechanoreceptors of the foot. Then we have the visual system collecting information on our surroundings, the environment, what is moving, what is not moving. And then the vestibular system, which serves as our internal GPS, allow us to have spatial orientation and allow us to detect linear and rotational movements and to have perception of the verticality, so of gravitation, of the gravitational vertical. And so besides collecting, or besides having all of these systems properly collecting information from the environment, is fundamental that this information is correctly processed and integrated at a central level. And because there are situations where they are not talking the same language, and some system is giving a conflict message, and we need to have the ability to quickly disregard that information and listen more to the others. And this ability, so-called sensory reawakening, is also fundamental, so we can maintain balance throughout our different environments or activities that are part of our normal daily life. Okay, so having all this working properly, then we can create the adequate movement strategy, the motor output. Okay, so if we think about all of this, it's easy to understand that balance is actually a very complex skill that requires a lot of different resources. And so this is my starting point, this article that in a very simple way explains this complex interaction of all sensory-motor process and all the resources that are required for proper balance control. Okay, and so if we, and as therapists or as doctors, when we have a patient with a balance dysfunction, we need to be aware of all of these resources and the complexity and interaction between them if we want to give a proper a response in terms of rehabilitation that targets what that patient has in terms of deficits. And so this article talks about biomechanical constraints, such as range of motion, muscle strength. We can think about also muscle tonus, limits of stability, which is a resource, let's say, that in itself also depends on a lot of other aspects. And even the presence of pain can also induce dysfunction to all of these big process. Then we have movement strategies. So there are fundamental, the reactive movement strategies, the anticipatory movement strategies, and the voluntary movement. So how to maintain balance within dynamic state, but a voluntary dynamic state. The sensory strategies, again, here the sensory reawakening, the ability we have to adapt to different tasks and different environments in terms of postural orientation. The ability we have to properly perceive the information from the environment, and another important resource, the cognitive processing. So we can think about attention, learning, focus, but there are also like other psychological factors such as anxiety towards movement, fear of falling, that we know that will also have a big impact on the final response. Okay. So moving to the movements strategies, because since this webinar main topic is perturbation-based balance training, we really need to talk about movement strategies. So there is not really a quiet stance. Our quiet stance, in our quiet stance, we sway always, because our body is not a balanced body. You can think of it being like an inverted cone, and even our normal internal body functions are enough to induce perturbations to our balance. And so besides normal muscle tone and the normal skeletal alignment, we need movement strategies in order to maintain our balance. And so we can think of also our body behaving like a multi-link pendulum with two existing modes of control. So we have the ankle strategy, where both legs and trunk move in phase. So there is more a subtle movement that happens within the ankle joint. And then the hip strategy, where the leg and the trunk move out of phase, and it is more notorious. So the goal of these movement strategies is to adjust the center of mass within the base of support to maintain balance when there's a perturbation or when we are going to perform a voluntary movement, but I'm getting ahead of myself right now, so let's wait. Okay, so they can be used in two different modes. Before that, sorry. We have the ankle and hip movement strategy, so where we want to adjust the center of mass within the base of support, but there are situations when it's not possible to maintain balance without creating a new base of support, and this is where the stepping strategy happens. And so now we can use these movement strategies or movement patterns in a feedback control mode as a reaction to an external disturbance. So and we have to adjust the center of mass position after a disturbance, such as when we are on a bus ride and the bus suddenly stops, breaks, and we have to respond to that perturbation. Or during gait, in response to unexpected disruptions of gait, such as a slip or a trip, and we need to react to that. If not, we're going to fall. But we can also use these movement patterns in a feed-forward control mode. So the adjustments that we are going to make that are unconscious and are based on prior experience in order to control our center of mass within the base of support to prepare to a voluntary movement that is going to be potentially destabilizing, such as leaning forward to pick up a heavy object. So we can use the movement strategies in these two control modes. Okay? So there are numerous causes and contexts where there are problems with movement strategies. So even the normal aging process is enough to lead to less efficient movement strategies. If we think about all of those resources, the aging process it's part of life. So there's going to be some dysfunction in one or more than one of all of those resources. And so this is something that we can expect. So impaired movement strategies can or are usually classified into different categories. We can have sequencing problems. So in the correct activation of the muscle chains, the synergies, the muscle synergies, there can be problems. There can be problems on that aspect. We can have problems with the timely activation of the response. So the response happens, but it happens too late, so it's not efficient. And then problems adapting to postural activity, to changing tasks and environments. So the sensory reweighting, when an environment changes, the sensory availability of that environment changes, and then we can no longer have a proper image of ourselves, and so the movement response is not going to be the most adequate to the new demands. Okay, and it of course happens in a lot of different clinical contexts, and even with older age. And this is where perturbation-based balance training can help. So this method aims to improve reactive postural responses to common types of perturbations that are felt on daily life. And as the name suggests, it consists on repeatedly exposing the patient or the participant to sudden balance perturbations while standing. And this method has been getting a lot of attention for the past years because it has been showing to have great results in some clinical contexts. And so there is already a good amount of evidence regarding the effectiveness of perturbation-based balance training in older adults without any history of falls, so let's say healthy older adults, but although older adults with a history of falls or with a higher fall risk, more fragile, there's already a good amount of research on this. For stroke patients, for multiple sclerosis patients, and for Parkinson's disease patients also. So these are maybe the more researched clinical populations or groups where this method it's showing very good results. For example, in Parkinson patients, or for Parkinson patients, perturbation-based balance training has been showing to reduce the delay in the activation of the postural response, to create a more stable reactive movements, which will lead to reduced center of mass displacement within the center of within the base of support, and that these changes are sustained over time. Okay. A population where there's still no information if it is a good strategy or not is for incomplete spinal cord injuries patients. So there is almost no research on this population. We can expect, or if we think on the effectiveness of this method on the other populations, that we can expect it to also have good results, but we still don't know. Regarding this population, the available studies are more focused on the anticipatory balance strategies, not in the reactive strategies. And so we have to wait for the results, such as from this study that I have here. This is just a protocol for the study, but I'm waiting on on the results to know. Okay, so now let's talk about the clinical implementation. So very important aspects. And for everyone that is doing this kind of intervention or is thinking about introducing it within their practice, I advise for the reading of this article, so Perturbation-Based Balance Training, Principles, Mechanisms, and Implementation in Clinical Practice, because it explains everything, and it's very recent. So I have read it a lot for the past weeks. So important aspects for the clinical practice. Regarding the perturbations, they should be difficult to predict. So in terms of timing, intensity, direction. So if we want to train reactive balance, the patient should not know, it should react to something unexpected. So if it can predict where it's going to happen and how it's going to happen, it can affect the efficiency of the training method. Then we have another very important, maybe one of the most important aspects of perturbation-based balance training is that the perturbations should really mimic daily life perturbations. It's because for the activation of the correct movement strategies, we have our prior memory or prior experiences of these perturbations in order to activate the correct muscle synergies and activate the correct movement strategy. So it makes sense that we want to train perturbations that we feel when we go on a bus ride, on a train ride, or well, on a well, I know on a boat. So normal, maybe boat is not that frequent daily life activity, but I think you understood what I was trying to explain. Then another important topic is the perturbations should have enough intensity to create a reaction, yeah, but they should be adjustable, so easily adjustable, because if we think about a perturbation, could be intensive enough to induce a response in a patient, but maybe is not intense enough for a different patient. So and even in the same patient throughout the training session, we should easily be able to adjust the intensity of the perturbations that we used. Okay. Also, other important aspect. So we should have the ability to measure the stability recover. So we should see how the patient is responding to the perturbation and on that session, and compared throughout the rehabilitation plan, throughout different sessions, to see if the movement strategies are getting more efficient or not. Okay, and this is what I have here to show you, which is a graphic from Kine-Sim that shows in yellow the movement of the platform, that here is a perturbation, and the blue line is the patient's response. Wait, sorry. The patient's response in terms of a center of pressure displacement, and in this case is on the anteroposterior plane. Okay, so we can see the perturbation happening and the response of the patient. And what we want to see is that the displacement of the center of mass is closer to the perturbation, and not with like big displacements within this plane of movement. Okay. Um, Now, to try to understand how can we improve balance skills, and how does balance improve with perturbation-based balance training. So research available on this subject suggests that the improvements in balance are resultant from improved feed forward control mode and improved feedback control mode. So when we do perturbation-based balance training, we are making improvements on the two modes of control. If we think about improving the feed-forward control mode, we can understand that since the adjustments of the predictive adjustments of the center of mass position are based on prior experiences, we can optimize these predictive adaptations with perturbation-based balance training, with activities that mimic daily life perturbations. And so if we improve these adjustments, if we optimize these adjustments, we can then understand that there's going to be a reduction in the disturbance of the perturbation itself, which will consequently lead to a decrease scale of the recovery response. So the intensity of the perturbation is going to be felt in a less, intense way. And then the scale of the response is going. We don't need a response much, let's say, much more obvious. We can have a decrease in the scale of the recovery response. And then if we think about the improvements that this perturbation-based balance training have on the reactive responses itself, so the early detection of the perturbation, the faster response initiation, and then also the optimization of the muscle synergies behind. And if we had the decreased scale of the recovery response, because we already improve and optimize the predictive adjustments to the center of mass position, it's now we can see how a balance can improve after these methods. Yeah. Okay. Again, this is all very well explained in the article. Okay. I have a short video showing how we can do this kind of training with Kine-Sim. I'm going to play it right now. I hope everything works. This is another very important aspect, is the security aspects of this training, because we are inducing a perturbation. We are well, it can be a bit stressful for the patient if a patient already has balance problems. If we are making it worse, let's say, we have to make sure we have all the security resources available. We are not taking any risks in terms of security of the patient, and so we can think of lateral bars, such as say that such as you saw there, but also sometimes an harness is required. And another important aspect that should consider is that there's sometimes it can be some anxiety and fear related to this method of training that it will by itself already constrain, give some constraint to balance control. And so we should start with small intensity disturbances and try to increase the intensity in a progressive way, and see if the patient is also not getting too stressed or is too afraid of doing the training, because if it is so, maybe it's not a good strategy to use on that patient. Okay? So this is just an example of a report from the bus activity. We have parameters of posturography analysis, the velocity of the center of pressure within the mediolateral plane and the anteropostural plane, and the global velocity, and also the displacement of the center of pressure, again, in the two planes of movement and globally, the total length of the displacement. And this is a way we have to see how unstable the person was during the activity. So if we see higher values of velocity and center of pressure displacement, means a less stable patient. And then we can compare the results from the baseline report with the current report to see if they are getting more balance during the activities, and they are using the strategies that they are using are getting more efficient because they are controlling the center of mass position in a more effective way. Okay, we also see the weight distribution within limbs, and the graphic I already explained on the other slides. Okay, so moving to motor cognitive training. So in healthy young people, so postural control is relatively low in terms of attentional demand, so cognitive load, but it increases when the postural task complexity also increases. And so the more difficult is a postural task, the more attentional resources are needed to maintain balance during that task. And this happens when patients or when people have balance dysfunction. When there's a dysfunction on balance, there's also an increase in the cognitive load associated with balance maintenance. And so we need to ask the question if there are enough cognitive resources to respond to this increase. Okay, and this is very important because our normal life requires us to move in different environments, and they are environments that are more attentional, demanding, more complex, and we have to shift our attention to different points of the environment and with different goals and tasks. And so if we think on a person that has already a balance dysfunction with in an environment like that, we can think that on that kind of environment, that patient may be at risk of falling, of losing their balance more easily. And so we need to ask what is the cost on balance when a second task is added, if we want to have a way to assess this. Okay, and this is what this article tried to understand. So they used the limits of stability test and compared the limits of stability area in seniors with healthy young adults, and of course, as it was expected, the limits of stabilities were much lower in the seniors because it's normal. But then they added a second task, and what they saw is that the cost on the limits of stability was much higher on the seniors compared to the young adults. So they were significantly more reduced when the second task was added compared with young adults. That it's also it reduced, but not at the same scale as on the seniors. And so this is where motor cognitive training can be considered a good strategy. This is an intervention that integrates both a cognitive and a motor task with the goal of improving cognitive function and also motor function. Okay, and this task, I already have the videos running. This method has also been showing to significant improve to induce significant improvement in balance and function, again in different contexts, but it for what I have studied, there are more studies on stroke patients and on the elderly patients, and this is the 3 studies I have here are from those populations. So the first study is a meta-analysis of a randomized control trial articles based on RCT articles, and what they saw is that the motor cognitive training significantly improved balance, gait, and upper limb function of chronic stroke patients. Okay? The second study showed that cognitive motor training improved again significantly balance in older adults and was highly efficient in both static and dynamic balance. And the third study results indicate that dual task training, so motor cognitive training, was successful in reducing the risk of falling in attention demanding contexts. So there's already, again, good evidence that it can help. With Kine-Sim, we can perform this kind of training. I'm going to, so these videos don't have sound. This activity, motor cognitive activity, the patient has to displace their weight in the mediolateral plane, keeping their center of mass within the moving rectangle, and at the same time they have to quickly validate the dots that appear on the screen, so interacting with the screen. And then the second video, the patient has to do weight transfers in the mediolateral and anteroposterior plane at the same time, controlling their center of pressure on a target that moves. So it has a cognitive goal of understanding where the targets are moving and what movement the patient needs to, what weight transfer the patient needs to perform in order to maintain the center of pressure inside of the targets. And the weight transfer activity itself is with the biofeedback is good for training balance. Okay. And so with Kine-Sim, we can train different aspects that will improve balance. So we can do weight transfer, stepping training, locking and unlocking of the knees and hips to then transfer to gait training. um, we can perform, and this was the biggest topic, the perturbation-based balance training. So train movement strategies during quiet stance, and also perform motor cognitive training. Then, of course, work on the limits of stability and on postural control, on sensory organization and reawakening. So a question of what patients can benefit from Kine-Sim. I will say that every patient that has some kind of balance dysfunction can benefit from working on Kine-Sim, uh, because Kine-Sim really allows us to target most of the resources that are needed for balance. And so it serves a very wide range of patients. Okay, so thank you for watching. I hope you find it useful. If you want to know more about this topic, we just released an article on our blog. I think was last week, so it's available on our blog. You have the link here. And we also have other articles with different topics about posturography, balance assessment, balance dysfunctions. We also have other webinars available on our YouTube, and other free resources such as an ebook and an infographic poster. If you want to have access to it, you can just email me, and I can send you all of that. Um, I really hope you find it useful. I want to thank you for being here and sticking here throughout the entire presentation. It means a lot. If you want to discuss any topics, if you have any questions about this presentation or other topics, again, you feel free to contact me by my email, or sorry, through my email, or through the general Sensing Future email. Okay, so thank you, really, really thank you. I hope you like it, and I think I will see you soon in another webinar that maybe is going to happen. Thank you.